How difficult is it to see something like this? I know you're a healthcare professional. You've been doing this a long time, but to see this many patients at once, this critical.
Right, and you know, we're used to seeing this, and we're used to seeing deaths at times, but it's daily. It's daily that we're having someone die from this disease, and that's what's taking a toll. We're not winning on a lot of these. Yes, we do make some patients better, and that's a win, and that's what we're all going for. But we realize there's limitations, and there's just so much that we can do. And there are a lot of these patients that aren't surviving. That's hard. That's hard on everyone.
So a lot of these patients that aren't surviving. It's hard on everyone. This reporting from NBC's Gabe Gutierrez in Billings, Montana, in one of 3 ICU units they're now using for COVID at that particular hospital. 14 patients intubated, 14 COVID patients intubated while Gabe was there. This is Joey Traywick, who works there as a nurse.
You know, at first, I hesitate to tell you this, but I was the nurse for, I was the nurse for the very first patient that passed from COVID in our hospital. And I thought, I've seen this before. I'm a nurse. I've been doing this a long time. I know how much time I have. I can tell by looking at her how acute this is. And I'll come back and check on her regularly. At that point, she was moderately lucid. And I came back to the room at one point, and she had passed by herself. And I thought, I'm never going to let that happen again. I am never going to let that happen again. It snuck up on me, and it surprised me because it's so relentless. And so 23 patients later, I don't miss it. If I have to stay late after work, if it means coming in on my day off, they're not going to pass alone on my unit. Again, none of them. I don't enjoy crying. I like to goofball and be funny, right? So I write smile on my mask so that people know I'm smiling under here. But it reminds me of the Charlie Chaplin song, right? Smile when your heart is breaking, you know, even though it's aching, you know, that thing where you think, for you, I'm going to be strong, and I'm going to call your family, and I'm going to tell them you're going to be fine, because that's all I have for you. I'm a good nurse. And the nurses that I work with are good nurses, but we are broken because we feel like we can't comfort those patients. And I think there's nowhere else on the planet I would rather be. I don't want to be anywhere else. It's killing me inside. I'm broken. I'm broken. And my colleagues are broken. And people say, it's not that big a deal. And I want to take them by the collar and say, you don't know what you're talking about. Come see my world for a week. The family members that are broken and the staff members that are broken.